Hello everyone, in this video we will be talking about MMT of scapular abduction and upward rotation, scapular elevation, scapular adduction, scapular depression and adduction, scapular adduction and downward rotation. Scapular abduction and upward rotation, muscle responsible is serratus anterior. For grade 4 and 5, patient position, short sitting over the end or the side of the table, hands on lap. Therapist position, standing at the side of the patient, hand giving resistance is on the arm proximal to the elbow. The other hand uses the web space along with the thumb and index finger to palpate the edge of the scapula at the inferior angle. Test. Patient raises arm to approximately 130 degree of flexion with the elbow extended. The scapula should upwardly rotate and abduct without winging. Instruction given to the patient. Raise your arm forward over your head. Keep your elbow straight. Hold it. Do not let me push it down. Grade 5. Scapula maintains its abducted and rotated position against maximum resistance given on the arm just above the elbow in downward direction. Grade 4. Scapula maintains its abducted and rotated position against minimal resistance given on the arm just above the elbow in downward direction. Grade 3. Patient position is same as the grade 4 and grade 5. Test. Patient raises the arm to approximately 130 degree of flexion with the elbow extended. Instruction given to the patient. Raise your arm forward above your head. Grade 3. Scapula moves through full range of motion without winging but can tolerate no resistance other than the weight of the arm. Grade 2. Patient position, short sitting with arm flexed above 90 degree and supported by examiner. Therapist position, standing at the side of the patient, one hand supports the patient's arm at the elbow. The other hand is placed over the inferior angle of the scapula. Instruction given to the patient, hold your arm in the position. Grade 2, the scapula abduct and rotate upward as the patient attempts to hold the arm. Grade 1 and 0, patient position, short sitting with arm flexed forward above 90 degree supported by therapist. Therapist position, standing at the side of the patient and supporting the patient's arm at elbow joint. Other hand palpate the serratus anterior, just in front of the inferior angle of the scapula along the axillary border. Scapular elevation, muscle responsible is levator scapulae, upper fiber of the trapezius. Grade 5 and 4, patient position, short sitting over the end or the side of the table, hands relaxed in lap. Therapist position, standing behind the patient, hands over the top of both the shoulder to give resistance in downward direction. Instruction given to the patient, raise your shoulder towards your ears, hold it and don't let me push it down. Grade 3, patient elevates shoulder in sitting position. Grade 4, patient raise the shoulder with moderate amount of resistance. Grade 5, patient raise the shoulder with maximum amount of resistance. Grade 2, patient position is supine or prone. Therapist position, standing at the side of the patient at shoulder level. Ask the patient to elevate the shoulder. Grade 1, muscle is palpated just above the scapula. Scapular adduction, muscle responsible is the middle fiber of the trapezius. Patient position, prone with the shoulder at the edge of the table. Shoulder is abducted to 90 degree. Elbow is flexed to 90 degree. Head can be turned on the either side. Therapist position, standing at the side of the patient which limb is to be tested. Stabilize contralateral scapular area to prevent the trunk rotation. When the posterior deltoid is grade 3, the resistance is given at the distal end of the humerus and the resistance is given in downward direction. When posterior deltoid is grade 2, the resistance is given at the shoulder joint in downward direction. Instruction given to the patient, lift your elbow towards the ceiling. Hold it, don't let me push it down. Grade 3, completes range of motion without manual resistance. Grade 4, completes range of motion with minimal amount of resistance. Grade 5, completes full range of motion with maximum amount of resistance. Grade 2, complete range of motion without the weight of the arm. Grade 1, muscle is palpated near the spine of the scapula. Scapular depression and adduction, muscle responsible is lower fiber of the trapezius. Patient position, prone with the test arm over the head to above 145 degree of abduction. Forearm is in mid-prone position with the thumb positioning towards the ceiling. Head may be turned to either side for patient comfort. Therapist position. Standing at the side of the patient. Resistance is given in the downward direction over the distal end of the humerus. Instruction given to the patient. Raise your arm from the table as high as possible. Hold it and don't let me push it down. Grade 3. Patient is able to perform full range of motion without manual resistance. Grade 4. Patient is able to perform full range of motion with moderate amount of resistance. Grade 5. Patient is able to perform full range of motion with maximum amount of resistance. For grade 2 and 1, patient position is same as for the grade 5. Therapist position. Stand at the side of the patient. Support the patient's arm under the elbow. Instruction given to the patient. Try to lift your arm from the table past your ear. Grade 2. Patient is able to perform full range of scapular motion without the weight of the arm. Grade 1. Muscle is palpated between the root of the spine of the scapula and lower thoracic vertebrae. Grade 0. No palpable contractile activity. Scapular adduction and downward rotation. The muscle responsible is rhomboid major and rhomboid minor. For grade 5, 4 and 3, patient position. Prone. Head may be turned on either side for comfort. Shoulder is internally rotated and arm is adducted across back with the elbow flexed and hand resting on the back. Therapist position. Stand at the side of the limb that is to be tested. Resistance is given at the humerus just above the elbow and resistance is given in downward and outward direction. Instruction given to the patient. Lift your hand, hold it and do not let me push it down. Grade 3. Patient is able to perform complete range of motion without any manual resistance. Grade 4. Patient is able to perform complete range of motion with moderate amount of resistance. Grade 5. Patient is able to perform complete range of motion with maximum amount of resistance. For grade 2, 1 and 0, patient position. Short sitting with shoulder internally rotated and arm extended and adducted behind the back. Therapist position. Standing at the side of the patient. Support the arm by holding the wrist. Instruction given to the patient. Try to move your hand away from the back. Grade 2. Complete range of scapular motion. Grade 1. Palpate the muscle under the vertebral border of the scapula. Grade 0. No contractile activity.